ENT doctor, PhD students. And you have a greetings from Kosovo. Today I'm going to present my study. The title of this presentation is Sinus Surgery in Children, Trends in Kosovo over a 9-year period. The paranasal sinuses are a common site of infection in children and adolescents and are associated with frequent morbidity. Rarely life-threatening complications occur. The aim of this study was to investigate cases of sinus complication in children treated over the last 9 years at the University Clinical Center ENT Clinic Head and Neck Surgery in Pristina, Kosovo. Uncomplicated sinusitis in children in the same health care system was treated on outpatient basis. In total, 366 children were treated with medications. Based on Chandler's classification, the most frequent was Group 1 with palpebral inflammatory edema, 27 cases, while the most infrequent was Group 5 with 1 case of septic thrombosis of the cavernous sinus. Children with sinusitis with complication had markedly higher CRP levels and ESR than those with uncomplicated sinusitis, like here. 6 children underwent sinus surgery and 50 were treated with medication. P-value was less than 0.101. There were 21 females and 35 males. Among the study subjects, p-value was higher than 0.05. 3 of the children had more than 1 sinus infection. P-value was higher than 0.05. Of the 56 cases with sinus complication, 9.3% had nasal polyposis. Sinus complication surgery in children is decreasing in Kosovo, not only because of the treatment with aggressive antibiotic therapy, but also because of the primarily surgical intervention such as septoplasty, adenoidectomy, and nasal polypectomy. Here is one of the case, the image of the 10 years old female patient with sinus complication. The ethmoid and maxillary sinuses are formed in the 3rd to 4th gestation month and accordingly are present at birth. It can be difficult to distinguish children with uncomplicated viral upper respiratory infection or adenoiditis from those with an episode of acute bacterial sinusitis. Most viral infection of the upper respiratory tract involve the nose and paranasal sinuses. However, bacterial infection of the paranasal sinuses do not usually involve the nose. When a patient with a bacterial infection of the paranasal sinuses has purulent nasal drainage, the site of infection is likely the paranasal sinuses. The nose is merely acting as a conduit for the secretions produced there. Acute bacterial sinusitis is a bacterial infection of the paranasal sinuses lasting fewer than 30 days, during which time the symptoms resolve completely. Subacute bacterial sinusitis is a bacterial infection of the paranasal sinuses lasting 30 to 90 days. During this time, the symptoms resolve completely. Currently, acute bacterial sinusitis is characterized by episodes of bacterial infection of the paranasal sinuses, each lasting fewer than 30 days and separately by intervals of at least 10 days, during which time the patient is asymptomatic. Chronic sinusitis is characterized by episodes of inflammatory of the paranasal sinuses lasting for more than 90 days. Patients have persistent residual respiratory symptoms, including a cough, rhinorrhea, or nasal obstruction. Material and methods. In this report, we describe 56 patients who were treated at the University Clinical Center ENT Head and Neck Surgery Clinic in Pristina, Kosovo. 6 of the patients underwent sinus surgery, while the other 50 were treated with medications. Preparation for all cases included X-rays of the sinuses. In all cases, we had positive finding of sinusitis, CT scan, axial and coronal imaging, blood analysis and microbiological finding, CRP, ESR, and white blood cells. Value. Allergen testing with 30 allergens was conducted in 35% of all cases of sinusitis with complication. Only 5 cases were positive for inhalator antigens. Ophthalmological examination, we found no loss of vision in any of 56 cases. Based on Chandler's classification, the most frequent was group 1, with 27 cases of palpebral inflammatory edema, while the most infrequent was group 5, with only 1 case of septic thrombosis of the cavernous sinusitis. There were 25 cases with orbital cellulitis, 2 with orbital subperiosteal abscessus, and 3 with retrobulbar abscessus. In 3 cases, we opened only 1 sinus, while in the other 3 cases, more than 1 sinus was opened. Of these patients, 64% had primary nasal infection and 9% had nasal polyposis. Result. A total number of 36 children with uncomplicated sinusitis in the same healthcare system were treated as outpatient with medication. The total number of patients with sinusitis complication was 56. Of these, 6 underwent sinus surgery and 50 were treated with medications. Here is table 1. Sinus complication in children by sex. Here we have, in 2003, we have 2 females and 2 males, in total 7.14%. In 2004, we have 8 cases, like 14.29%. In 2005, we had 3.57%. In 2006, we had 1.79%. In 2007, 10.71%. In 2008, 7.14%. In 2009, 20.5%. In 2010, 16.07%. And in 2011, 26.79% of cases. In total, 56 cases.